Hello, my name is Dr. Finian Fallon. I'm a psychologist and psychotherapist from Dublin, Ireland. In this third Q&A with Dr. Mally Coyne, we'll be discussing issues related to compassion fatigue or burnout and childcare issues, as these may affect frontline workers. Thank you. So Mally, in this video we're talking about compassion fatigue and those kind of issues and self-care for frontline parents. Like we know from the research that's out there that in times of crisis people might be more likely to suffer from post-traumatic stress and stress disorder, and there's various names for it. Compassion fatigue is something that might happen for people who are working in the front line of these activities during a time of crisis. Can you tell us a bit more about what compassion fatigue is?
Yeah, the word comes from, or the term comes from the fact that as caregivers, you express compassion towards others. You care about others, and many caregivers or people that find themselves as frontline workers have been caregivers all their lives. They're drawn to that kind of work because maybe they had that role when they were younger in their own families. It's just something that comes very naturally to them, and that's what we found. Psychologists, looking at it, have found that to be the case. So compassion fatigue. Fatigue means tiredness. So during this COVID-19 crisis, because it's been going on for quite a while now, and as a frontline parent, you would find yourself becoming, both emotionally and physically overwhelmed, perhaps by by this crisis and by having to respond to it for many, many different reasons. And not every frontline parent is going to experience compassion fatigue, but it's basically an accumulation of stress over time that'll impact on you. It's like what we call burnout, really.
Yeah. And how might that affect parenting and interactions with children for frontline workers?
I think it would really impact on the parent, on the person themselves, over in terms of all their interactions. Because when you feel like you're spread too thinly, both at work or at work, you probably will feel like you're not doing a good enough job at home as well. I'm sure you found yourself, Finian, that when you're feeling quite stressed as a person, or that you would feel like everything you're doing is wrong, and you feel quite anxious, and you're in that fight or flight kind of mode in your brain. And so you might feel very overwhelmed when you go home and find it harder to switch off from work and kind of be open to the parenting role that you have. So you might actually end up feeling overwhelmed at work and overwhelmed at home, which obviously will have an impact on those relationships that you have at home as well.
Yeah, some frontline workers talk about losing their empathy or not having as much empathy, and that can leak over into the home situation. But how would the parent know, frontline parents know, if it got to the point where they might need some help from a professional psychologist or some kind of support?
Yeah, I mean, I think it's important to point out that many frontline workers, parents, will be experiencing a certain degree, you've said it in your videos before, of stress and anxiety at the moment. Like, that is normal, to an extent, to have some level of it, because you are operating from a more threat kind of based response, and that's normal. That's kind of like, our fight or flight response is a good thing because it kind of mobilizes us to do our job and to do our jobs, and that can be a good thing. But I suppose you have to be, you're more concerned when that fear and anxiety turns into something more serious, where it's really starting to impact on your ability to do your job, your ability to be a parent at home, or to be, in other aspects of your lives. It starts to spill, if you know what I mean. You start to feel like everything is too much for me. You start to have very negative thoughts, maybe like, this will, when will this will never end, or I'm no good. That critical voice that we all have inside our heads will start to become quite loud, and will maybe start become quite shouty. You're doing such a terrible job of this. And when that becomes an excessive thing, and it starts to impact on your emotional well-being, but also on your physical well-being, you might kind of stop recognizing the signs you need to look after yourself. You might, your sleep might be impacted on, your diet, all those different aspects of your life. Then you know that you need some more help.
Yeah. I know a lot of people I work with, like they might be what we call high functioning individuals, especially in the medical field. People are very hard working, get through a lot of workload, and are able to cope on the face of it, but don't maybe take enough breaks and that kind of thing. We hear this term self care talked about a lot. Could you tell us a bit from a psychological perspective why it's so important and
Hmm.
why it is especially important for frontline care workers at the frontline workers at the moment?
Yeah. I mean, we do hear the word self care a lot, and I think sometimes people undermine it. They think, oh, yeah, self care, oh, yeah, we all need self care. But, like, from a psychological point of view, I like to look at it. I'm really into this idea of compassion focused therapy. And in compassion focused therapy, we talk about having three emotional circles. And one is our threat circle, which is, our fight or flight response when we're feeling angry or anxious, or the kind of that circle, and that is quite activated at the moment because of what's going on with this crisis, and it would certainly be for frontline parents. The other circle is our drive circle, what gets us up in the morning, what makes us feel a sense of achievement. That's our drive circle. And then the third circle, which is a very crucial circle, is our soothing circle, which is all about how we soothe ourselves, and and that's all to do with self-care, doing things for yourself to make you feel like yourself, but also connecting with others. That's the crucial aspect as well of soothing. The soothing circle is connecting with others, because we're all human beings that need connection with others, and that need, when we actually are stressed, we release oxytocin, which is our bonding hormone, which is our need to connect with others, which is quite incredible. They say that stress gives us access to our hearts. So, when you're stressed, if you are feeling stressed, you do need that connection with someone else. But what you find with frontline workers and parents probably now is that their threat circle might be quite big, and their drive circle might be quite big, because they're getting to work, they're going to work every day, and the threat might even be feeding the drive circle. So they might have thoughts of, if I don't work 12 hours a day without taking a break, then I'm not good enough. This is what I was born to do. I need to mobilize. I need to do this. But what happens is their soothing circle ends up being quite small, and that is going to really be detrimental to your mental health as a frontline parent or worker, because you have to have some type of balance of those circles in order to function. So, in fact, you're doing yourself a disservice if you don't engage in activities that give you space away from the stress, because you won't actually be able to function, and that will lead to things like compassion fatigue and burnout, as we mentioned.
Yeah, I really like that idea, the threat circle, the drive circle, and the soothing circle. I think they're kind of even reflective pieces that parents could do to just to draw those and fill in aspects of their lives that contained in those circles. In those circles, are there any other sort of practical tips you could give parents for kind of the self care strategies they might be
Yeah.
able to engage in?
Well, I think for frontline parents, it's really important to kind of get back to the basics of what it is that you need. So, sleep is obviously hugely important to. I know we talk about it all the time, but it's about recharging your batteries and being able to to have a nice little sleep routine for yourself. To limit exposure to too much news, social media, that kind of thing. You've enough threat going on at work without having the threat. So kind of reduce the stressors when you get home. We spoke about it when we talked about having children, and trying to kind of be in the moment, in the present moment with your children. Focus on what you can control rather than what you can't control. I think things like eating healthily, I think it's harder right now for frontline workers and parents to find places to eat, and to I think it's important maybe to give yourself a bit of time to prepare something to eat before you go to work. I know it's really hard, when you're so busy, but really, having good food with you is going to really kind of see you through. Stuff that's really nutritious for you will see you through. I think engaging in things, kind of asking yourself, what is it that builds my energy? What is it with me as a unique human being that makes me feel most like me? What do I need? And I think taking that pause and kind of asking yourself that, I think for some people it will be picking up the phone and connecting with other people. And I think connection and support, asking for support. Don't be afraid to ask for support. You are a frontline, parent, and it's hard. And something else you mentioned, Finian, in one of your podcasts, which I really liked, was that superhero tag you were talking about.
Yeah.
Yeah, I kind of liked, like, I know we're all talking about frontline workers being superheroes, but I think it could place an unnecessary pressure on them to be superheroes at home and superheroes in every aspect of their lives. And I think it's really important for us to come back to the basics of, compassion focused therapy talks about things like common humanity, which is all about, we're the whole human race practically are experiencing difficulty at the moment, and you're not alone in this. Like lots of frontline workers around the world are feeling the way you're feeling and are feeling the pressures you're feeling. And that idea of mindfulness, which is, this is really hard for me right now, but as you say, Finian, this will pass. But I need to acknowledge, and I need to try to stay in the present moment. Somebody talked about habit stackers, where maybe every time you brush your teeth or you wash your hands, you might think of something you're grateful for. So it's not that you're starting a new mindfulness practice altogether, but you're stacking one practice onto another so that it becomes more natural to you. And then the third one would be about self-kindness, and knowing that being kind to yourself releases oxytocin in your body, which is that feel-good hormone. It helps you to cope. It helps to reduce stress and anxiety, and it helps you to connect with other people, which is what you really need at the moment.
Yeah, I think connection is huge, and that thing with the hero idea, I think is interesting.
Yeah.
I think it's more, certainly as someone said online, people are engaged in heroic acts. It doesn't necessarily make them heroes as such, and again, that can put a lot of pressure on people. And again, also this war imagery as well doesn't necessarily help. I think from a compassion perspective, we might talk about journeys and process rather than destinations and war and peace and that kind of things. And also, I really like that idea of seeing ourselves as part of a greater whole, in terms of the whole world is struggling with this, and there's lots of amazing people doing lovely things and very kind things with each other, notwithstanding that this situation will go on for a while. But also, even normalizing this situation in ourselves, accepting it as normal for the moment. As we said, this will pass. And again, another idea, I suppose, a compassion-focused idea is related to acceptance, which people sometimes criticize compassion-focused therapy for as kind of a giving up, but I don't see that as that at all. Attachment is accepting reality and dealing with reality and responding to it. It isn't giving up at all.
No, and like emotions are meant to kind of go through your body. So if we try to kind of resist the way we're feeling, it's gonna come up in other ways. Whereas if we can just try to feel it, then we'll come through it better. If and it's okay to be having a really hard time sometimes. I've found this to be a roller coaster of a time, where sometimes I feel I can do this. I can do this. I, as a parent, as a worker, I'm able for this. And then other times I feel quite, it's very hard to deal with the whole uncertainty of it, and it's difficult at other times. And I find connecting with others during those times, or else taking a moment to myself and maybe reading a bit or going for a walk or something, really, really helps to kind of just it's not about being happy clappy. It's just about getting through the difficult times.
Yeah, and making the most of those buffer moments or those breaks. I like this idea. I'm sure you've heard of John Kabat-Zinn's book, Full Catastrophe Living. I think really, and again, this isn't something to say to sort of catastrophize, but we are living in a bit of a catastrophe at the moment, and we are trying to find a way of living in this, and it will pass, but it is a process of acceptance and working through as best we can. I suppose from in terms of the resources and supports that are available out there for frontline parents, Mally, do you have any suggestions or recommendations for people?
Yeah, there's some really good websites that have been set up, Finian. There's mindthefrontline.com. That's actually an Irish website of 3 psychiatrists in Dublin, where they have amazing articles and videos and meditations there for frontline staff, and loads of supports. Like there's actually free counselling, online counselling available for people out there, for frontline workers out there. Therapy Hub and the Trauma Response Network. Those links are all on mindthefrontline.com, and there was a brilliant article in there about minding the superheroes, and I just found that website really good. In the UK, you've got a really good website called supporttheworkers.org that has really good resources on anxiety and fear and readiness and resilience and different things for frontline workers that would be really helpful to them and possibly to their managers as well in terms of what to look out for with your workers. My own website has the COVID-19 resources, and in those resources you talk about compassion-focused therapy. There are video links to free kind of webinars on compassion-focused therapy. You know, if you're not into like reading stuff, you can just kind of put the headphones in and go for your walk and listen to something. There's some nice free resources there on compassion-focused therapy. And then obviously the Heroes Aid, you know, website, you know, this is why we're doing this particular podcast. So there are many resources out there that you can avail of as a frontline worker. And please don't be alone if you feel like, you know, your stress and overwhelm is really impacting on you, then to really try to get some support because it is out there for you.
Great. Thanks very much, Melanie.
Thank you.